Hello and welcome to another episode of The Molten Truth. I am your host, Zoe Michaels. Today, we get to actually talk with someone, what I think is a very interesting topic, and I can't wait to dive deeper into it. But before we get started with Dr. Sal's primary topic, we're going to talk to him a little bit about who he is, his credentials, and then we're going to lead into the special interest topic. So, Dr. Sal, thank you so much for being here today. I'm glad we were able to coordinate our schedules to make this work.
Thank you so much for having me,
You're
Zoe.
very
Thank you.
welcome. So we were talking off stage just a moment ago. You had mentioned that you are already established in a field of science. It sounds like maybe you have a doctorate, maybe?
Yes, I'm a gastroenterologist. I have experience of more than 30 years and I'm a board certified physician and nutritionist and hepatologist. And my prime interest is in educating people about gut health, inform people about how best to approach their gut health in order to get the overall good health. So I've been doing that for many years now. The educational part on social media I have taken on since early this year and have established myself. I have fellowship training from Brown University and my primary residency training from University of Chicago. And I've been professor at multiple institutions and have done research in and published in scientific journals and have written a couple of books and some chapters as well. I have done overall a variety of work in regarding gut, from bench work to actual clinical studies and drug trials. I'm here now to just let people know that I'm here to educate and this is my mission.
That's very interesting. And we talked about gut health beforehand, but I did not put that together with you being a gastroenterologist. So you say that, and I go, oh, ding, 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 okay. Because in my day job, the job that pays the bills, puts the roof over my head, I work in the medical field myself. I work with primary care physicians, booking their doctor's appointments.
Wonderful.
So very often I get people saying, okay, well, my doctor referred me to the gastroenterologist for this or for that. But, I never think of it as a proactive thing. I usually think of it as, oh, someone's seen their doctor and now they have this huge problem and now it's time for the specialist to step in.
Right.
That's really all I know about gastroenterology, as I think of that as a specialized field. So this is kind of a nice opportunity for me, actually, to be a bit of an insight into what it is a gastroenterologist really does and how they help, and if there is anything proactively that people can do.
Sure. So my work actually is, yes, we treat the conditions of GI, irritable bowel syndrome, inflammatory bowel diseases, Crohn's, colitis. But what we're seeing more and more is that in general, people lack information that they need to actively do something about their gut health. Gastroenterologists, by the time you reach there, we diagnose the cases. We do endoscopies, colonoscopies, we diagnose many conditions. But once you know that there's a lot of GI conditions which are functional, which means they are related to the gut and brain talking to each other. We call it disorders of the gut-brain interaction. Those are the things that you have to take care of. As if you learn more about it as patients, you will be able to manage it, prevent, and save yourself from future catastrophes if you act early on and are informed about it. Just like if you take good nutrition, you take care of your gut health, you're gonna need less of actual gastroenterology, right? From the gastroenterologist, you're not dependent on that because you're doing a preventive work. But once you have certain red flags, you need a gastroenterologist, right? You cannot self-diagnose. Then the gastroenterologist will go through the process of eliminating diseases, and then if they diagnose you with, suppose, irritable bowel syndrome, that's a functional GI problem. That's a gut-brain interaction disorder. Then you have to take care of it different ways. Gastroenterologists will not have medications for those things, for example. But then you have your nutrition, you have your diet changes, you have your lifestyle changes. You will have hypnotherapy that can also help your gut symptoms. You will have guided imagery and other cognitive behavior therapies. You may have yoga to help you. Those are the things that you will have to look into. And a good gastroenterologist can actually guide you through the whole process. So one of my job is also to try to teach people to ask the right questions to your primary care doctor and ask for the referral to GI and identify and know about what red flags to worry about and what conditions not to worry.
So, for example, I'm gonna just use a case. Someone who has I would call by normal standards healthy eating habits. They eat mostly at home, don't really eat much in the way of sugar. They try to eat very low salt. They eat, a lot of vegetables, maybe not so much fruit, but they love their meat. But, they keep packing on the weight despite eating what they would consider a comparatively healthy diet compared to most Americans. I mean, is that someone who would need to see a gastroenterologist? Or, what could they do to affect their health? Because, I think of food as medicine.
Right. So, yes, so the important thing to understand is that the weight gain and the obesity part that we're dealing with, it is multifactorial. It has many, many reasons. But from the standpoint of my studies from gut microbiome, we now know that lean people and obese people have different kind of gut bacteria. This has been shown in the studies of mice that when they took the gut stool samples from lean mice and gave them to the regular mice and then gave them to obese mice, they found that the obese mice started becoming lean. And if they gave the gut microbiome through the stool specimen from the obese to the lean mice started getting bigger. So this is what we are. Like, it is our microbiome inside determines what our weight is going to be. And the important thing to take care of is, like, if your gut microbiome is healthy and diversified, then the chances are you will not gain much weight and in fact start losing. So how do you take care of your gut microbiome? So nutrition, yes, we talk about nutrition, but your gut microbiome needs specific kind of nutrition. And the most important thing is the prebiotics. And I'm not talking prebiotic from the shelves of the pharmacies. I'm talking prebiotics in food, which are soluble fiber. All soluble fiber are like prebiotics. And what is prebiotics? Prebiotics are the food that help your gut bacteria, that feed your gut bacteria. So the probiotics are the live bacteria, and pre is the food for the pro. So when you take probiotics from the shelves, they are actually live bacteria that go in and replenish your system. But the prebiotic is actually most important, and that is the kind of food you eat, which is all soluble fiber, which is where you come from all kinds of nuts and seeds, edible seeds. You have beans of all kinds. You have variety of lentils. You have chickpeas. That is where the real prebiotic is. So when you eat those kind of soluble fiber, the nuts and seeds, the beans, the lentils, the chickpeas, they are going to feed and make your gut bacteria stronger. When they are strong, then they're going to send signals throughout your body. They create insulin sensitivity, so your insulin resistance and diabetes will improve. They regulate blood sugar, they regulate blood pressure. All these kind of substances that these bacteria, the gut bacteria, will create after eating this prebiotic. So this is not only the colon health that they will establish, but throughout the heart, the blood pressure, the kidneys, and insulin resistance and diabetes. It affects everything, and the weight, because it creates that satiety, it creates the satisfaction. So this prebiotics also creates satiety in your stomach, so you stop craving for food. And that is how you start maintaining your weight too. And when you talk about probiotics, we have to make sure that you know that the yogurt with the live cultures, sauerkraut, sourdough bread, kimchi, and pickles without the vinegar, they are all good sources of live bacteria. Okay, if you take these on a regular basis and you eat enough of prebiotic food, chances are you're not going to gain more weight and slowly start losing. So the other thing is important is like Metamucil or psyllium husk fiber. That has been shown that if you take that on a daily basis, every day, 1 teaspoon is 4 grams in a cup of water. If you take it twice a day, the Metamucil fiber, it sits in your gut and it gives you the feeling of fullness. Besides working on you reducing your blood sugar, reducing your blood pressure, and creating better heart health, and gut health, this psyllium is actually going to stop you from eating too much and you start maintaining your weight. So if people take this on a regular basis, they will definitely start losing some weight over a period of time and they're not going to crave much food. Again, eating the nutrition, the right kind of food is important because that is where your gut microbiome starts changing. If you eat highly processed, ultra processed food, okay, your regular healthy gut bacteria are going to start dying and they will be replaced with other harmful bacteria which will have more role to play in your gut, and your gut lining or the barrier will start getting damaged. So the toxins and other chemicals are going to go into your bloodstream and have a reverse effect because they will create more problems for you. And this is why we're seeing increased number of heart diseases and blood pressure issues and diabetes and obesity because of the gut microbiome that is damaged.
And so let me segue into this because I had asked you about your website earlier on. So gutsavior.co, your website.
Mhm.
Will we find a lot of that information and guidance on that website, or what kind of information will we find there?
I want people to actually, there are some free information, of course, about what kind of red flags that you should be worried about so that you can reach out to the doctor and the gastroenterologist can do something about it. And also what kind of questions you need to ask your doctors in order to get the best care in the little time that you have with your physician. The more prepared you are, the more proactive you are, the more you're going to get out of that doctor visit. Your doctor has limited time and you cannot expect you go in and everything's going to be fixed if you have no information, if you're not armed with any knowledge or information. So this is where you start somewhere higher, then you get higher and higher amount of information. So that is what I like to teach. And then I also offer one-on-one as a second opinion for anybody who wants to have questions. And I make sure that I'm not telling them that I'm giving you a treatment. I'm not prescribing anything on that website, but I can meet one-on-one to help you guide through the whole process, to help you navigate the system, ask the right questions to the doctors, and maybe help you ask for diagnosis and ask for the workup that might lead to the possible diagnosis. So it will be like a second opinion that I can offer for 30 minutes or 1 hour or 2 hours.
Absolutely.
So that's another thing I do. But the premise is not treatment. The premise is so much educational and guidance.
And I think there's a lot of value in that because unless you take the time to really dig in and research, we're lost. We go to the doctor's office and, we're completely lost. Even when we look at a lab report that we get back, sometimes even before the doctor sees it, we're looking at those lab reports going, oh my goodness, we must be so sick because we see, oh, this says abnormal, and we're conjuring in our mind the most worst case scenario. And then we get this message back from our doctor, your results look fine, take a little this, take a little that.
Right. This is so true. Yes, but so that is why it's most important that, you ask the way the doctors think. We need to know that. Public should know that. Then you ask the question. So there are people who come to me, patients, over and over, and they say that the doctors haven't given us any diagnosis. And this is not fair. So one has to ask the physician, like, what are you thinking, doctor? Vocalize. Because doctors are still in that attitude and in that frame of mind that I will give them the answer when I have the answer. But then you should communicate more with your families or your patients who come to you that, look, the right kind of question would be, doctor, what is the diagnosis? And the doctor says, we still have to investigate. Okay, doctor, what is your differential diagnosis? What are the diagnoses you are thinking and going to eliminate? At least tell me that. So then now the doctor is interested. When you use the right term, the differential diagnosis, now he's going to say, okay, the possibilities are IBS, IBD, ulcer, this. And then you ask, okay, what is the most likely scenario?
It's almost like...
Then the doctor will think, it's like doctors are like ChatGPT.
I was just going to say that. Exactly.
You have to be very specific.
Yes.
Specific questions you ask, you get the right answer. So, okay, doctor, if I'm doing, if doctor says I need to do endoscopy, why do you need to do the procedure? And if we don't do the procedure, what are the things we can do without the procedure? If you are, you know about these things, then the doctor can say, okay, I can rule this out, rule this out, rule this out. But it is also possible that the doctor might not have considered. Some doctors are make a diagnosis very fast, others take a long time. So the first thing I do when the people come to me, I give them a diagnosis. Most likely diagnosis is this. Now I'm going to rule out this condition with this blood test, this condition with this investigation, this condition with this imaging and CT scan. Why am I doing everything? Everything should be known. But if we don't ask, we look like, to be frank, I mean, I was like that before the medical field, before becoming a physician. I would go and think my doctor would figure everything out. I don't have to, I'm hesitant to ask the question and things. This is a patient mentality. We feel that doctors will figure everything out. But you have 10-15 minutes and you're going to be sent back home without knowing anything.
Well, it's really kind of an unfair proposition when you think about it. You see a patient for 10-15 minutes. You don't really get to see them in their day-to-day life, so you don't get to see and how they live, what they eat. You can only rely on what they tell you, assuming that they're being 100% truthful in everything and not forgetting to tell you all things. And then on top of that, if you are wrong, then there's a liability issue because people will hold you to your words. You are the expert, and that's really there's a lot of expectation for
it's a difficult situation. It's a difficult
yeah. I mean, it's amazing.
It's a difficult situation.
It's amazing